13 early warning signs of prostate cancer. After 50, don't ignore these. Robert was 58 years old when he noticed something was off. Nothing dramatic, nothing that screamed emergency, just small things he kept brushing aside. A few extra trips to the bathroom at night, a little pressure he assumed was just getting older, a tiredness that rest never seemed to fix. He told himself it was stress. He told himself it was age. He told himself he would get it checked, eventually. By the time Robert finally saw his doctor 18 months later, the cancer had already spread beyond his prostate. His doctor told him that if he had come in just 12 months earlier, the outcome would have been completely different. Robert's story is not unique. It happens every single day across America. And it happens because most men over 50 simply do not know what to look for. By the end of this video, you will know all 13 warning signs that Robert wished he had known. And you will never look at these symptoms the same way again. Before we continue, drop a comment right now and tell me what country or state you are watching from. I read every single comment, and I would love to know where my viewers are coming from. If you are new here, this channel is dedicated to helping people over 50 live longer, healthier, and more informed lives. Whether you are watching on your phone, your computer, or on your TV at home, hit that subscribe button right now so you never miss what's coming next. Prostate cancer is the second most common cancer among American men. According to the American Cancer Society, approximately 1 in 8 American men will be diagnosed with prostate cancer during their lifetime, and the risk increases dramatically after the age of 50. What makes prostate cancer particularly dangerous is not how aggressive it can become, but how quietly it begins. In its earliest and most treatable stages, prostate cancer often produces no pain whatsoever. Instead, it produces subtle changes that most men dismiss as normal aging. That is exactly why knowing these 13 warning signs could save your life. The prostate is a small walnut-sized gland located just below the bladder. Its primary job is to produce fluid that nourishes and transports sperm. Because of its location, directly surrounding the urethra, even small changes in the prostate can affect urination, sexual function, and pelvic comfort. Think of the prostate like a ring around a garden hose. When that ring swells or changes, the flow through the hose is affected. This is why so many early prostate cancer warning signs involve urination. The prostate and the urinary system are inseparable neighbors. When one is affected, the other feels it immediately. The first sign is frequent urination, especially at night. If you are waking up 2 or more times per night to urinate, this is called nocturia, and it is one of the earliest and most commonly ignored signs of prostate changes. Most men blame it on drinking too much water before bed, but when it becomes a consistent pattern, it deserves medical attention. The second sign is a weak or interrupted urine stream. If your urine flow has noticeably weakened or starts and stops during urination, this could indicate that the prostate is pressing against the urethra, reducing flow. This symptom is easy to rationalize but should never be ignored after 50. The third sign is difficulty starting urination. You stand at the bathroom and wait longer. This hesitancy, called urinary hesitancy, is a classic sign of prostate pressure that most men live with for years without ever mentioning to their doctor. The fourth sign is a burning or painful sensation during urination. While this symptom has multiple possible causes including infection, any persistent discomfort during urination is worth discussing with your doctor without delay. Quick pause here. If you haven't already watched our video on the 6 best exercises you can do at home after 50 with no gym needed, check that out after this. It pairs perfectly with everything we cover on this channel. The link is in the description below. The fifth sign is persistent lower back, hip, or pelvic pain. A dull ache in your lower back, hips, or pelvic area that never fully goes away, especially without a clear injury, can sometimes be connected to prostate health. Most men blame their office chair or old age and never make the connection. The sixth sign is blood in the urine or semen. If you notice blood in your urine or semen, it is important to see a doctor promptly. Do not assume it will resolve on its own. Schedule a medical appointment as soon as possible and mention this symptom specifically. The seventh sign is a feeling of incomplete bladder emptying. You finish urinating, but something does not feel right. The bladder feels like it still has more. This sensation is directly linked to prostate health and should always be evaluated by a medical professional. The eighth sign is erectile dysfunction. This is the sign most men are too embarrassed to mention even to their doctor. But the prostate and its surrounding nerves play a direct role in sexual function. Any sudden or significant change in this area after 50 is absolutely worth discussing with your doctor openly and without embarrassment. The ninth sign is pain or discomfort when sitting. Unexplained pressure when sitting for extended periods can sometimes be related to prostate inflammation. Because the prostate sits in the pelvic region, an affected prostate creates pressure that becomes more noticeable in a seated position. Most men assume it is their back or their chair. It is worth getting checked. The 10th sign is unexplained weight loss. Your diet has not changed. Your activity level has not changed. But the weight is coming off anyway. Sudden unexplained weight loss is a general cancer warning sign that applies directly to prostate cancer and should be mentioned to your doctor immediately. The 11th sign is fatigue that does not improve with rest. You sleep 8 hours and wake up exhausted. Persistent unexplained fatigue that rest simply does not improve can sometimes be linked to underlying health conditions, including prostate cancer. Most men blame stress or age and never get it checked. The 12th sign is swelling in the legs or feet. This is one most men would never associate with their prostate, but when prostate cancer affects nearby lymph nodes, it can disrupt lymphatic drainage, causing unexplained swelling in the legs or feet. If you notice this alongside any other signs on this list, please bring it to your doctor's attention immediately. The 13th sign, and the one that surprises everyone, is changes in bowel habits. Because the prostate sits close to the rectum, an enlarged or affected prostate can sometimes place pressure, causing changes in bowel habits, including constipation or a persistent feeling of fullness. Most men never connect this to their prostate. Now you know to. None of these 13 signs alone confirms prostate cancer. Many have completely benign explanations. But if you are recognizing 2 or more of these signs, especially after 50, please do not wait. Book an appointment with your doctor and ask specifically about a PSA blood test. The PSA, or prostate-specific antigen test, is a simple blood test that can detect early signs of prostate changes before symptoms become severe. The American Cancer Society recommends that men at average risk discuss PSA testing with their doctor starting at age 50. Men at higher risk, including African American men and those with a family history of prostate cancer, should have this conversation at 40 or 45. Early detection saves lives. The survival rate for prostate cancer detected in its earliest stages is nearly 100% according to American Cancer Society data. Do not be the man who knew the signs and did nothing. Robert eventually completed his treatment. It was harder than it needed to be, longer than it needed to be, more frightening than it needed to be, all because he waited. You now know what he did not know when it mattered most. You know all 13 warning signs. You know what to ask your doctor. You know that early detection changes everything. Now I want to hear from you. How many of these 13 signs were you already aware of before watching this video? Drop your number in the comments. I read every single one personally. And if this video helped you, please share it with the men in your life over 50, a father, a brother, a friend. It might be exactly what they need to hear today. Make sure you watch our next video. The 6 best no-gym exercises you can do at home after 50 to keep your body strong and your health protected. The link will appear on your screen right now. Don't forget to subscribe if you haven't already. New videos every week built specifically for people who refuse to let age slow them down. Everything shared in this video is general health information based on current research and publicly available medical data. It is not a personal diagnosis or a replacement for care from your own doctor. Always consult your physician or qualified healthcare provider if you are experiencing any of the symptoms discussed in this video or before making any changes to your health routine.